Hello and welcome to Sanjeevani United Against Cancer, Network 18's groundbreaking campaign in partnership with Federal Bank, Hormuz Memorial Foundation, and Tata Trust. Did you know nearly 70% of cancer cases in India are found too late? We are here to flip the script, turning fear into power through knowledge, screening, and myth busting. Today, we are zooming in on cervical cancer, one of the deadliest yet most preventable cancers hitting Indian women. The villain? HPV, a super common virus. The heroes? Vaccines and regular screening. If you are a parent, teacher, health pro, young woman, or just someone who cares, now this episode is your must watch. I'm your host, and joining me is Dr. Jayesh Sharma, a surgical oncologist with more than 25 years of experience in fighting cancer. You've seen his work on social media. He's there to bust many myths. Thank you so much, Dr. Sharma, for making time and speaking to us and helping so many women and men out there, share your knowledge and wisdom with us. How are you feeling today?
I'm fine, and thank you so much for inviting me. This is giving me another platform to share all the information that I think everyone should know about cancer.
All right, so let's start with the basics first. Why cervical cancer still kills despite being preventable?
So, there's this very old thing that I always say. And do you know which is the biggest cancer in India? No, it's none of the cancers that we know about. The biggest cancer in India is that we fear the treatment more than we fear the disease itself.
Yes.
And हमको बीमारी से डर नहीं लगता, हमको लगता है कीमोथेरेपी हमको नहीं चाहिए. We never think about the consequences of not getting treatment and always worry about what will happen if we do get treatment. So that delays diagnosis, that delays even going to the doctor, and even after the diagnosis, it delays our getting treated because the fear of treatment stops us. That is the root cause. The second is this is something that needs a very strong public health will from the government. Without that, cervical cancer cannot be tackled on an individual basis by a doctor or a group of doctors or by the population per se. So that strong will of government needs to be there, and the civil society needs to support that. The way we have defeated polio was so common, and we have defeated that. Last more than a decade, there has been zero cases of polio in India because it needs that strong will. So once these two things are there, we are willing to get treatment and the government is willing to give that to us, we will defeat it.
Right. So, what can people do in order to spot the early symptoms?
Cervical cancer is very easy to spot. Even if you don't go for screening, it's very easy to catch the symptoms early. The first symptom is any abnormal bleeding from your vagina. So first symptom that we generally see is post-coital bleeding. So after an intercourse, if there is any bleeding, when there is no other abnormal bleeding, that is generally the first sign. The second sign is postmenopausal bleeding. The third is intermenstrual bleeding between two periods if there is any bleeding. Profuse bleeding is generally not a very common sign of cervical cancer, but foul smelling discharge is another sign that there might be something going wrong. If we ignore at all these stages and we allow it to grow, then we end up with pain. So like in most other diseases, most other cancers, pain is generally not an early symptom of cervical cancer. So पेन के लिए वेट नहीं करना है. बिफोर दैट वी नीड टू गेट इट ट्रीटेड.
जैसे आपने कहा पेन के लिए वेट नहीं करना है एंड यू स्पोक अबाउट ऑल दीज सिम्टम्स व्हाट इज द फर्स्ट स्टेप वन शुड टेक after spotting these symptoms?
So first step is going to a gynecologist, your friendly neighborhood gynecologist. They will be able to just check you and they can figure out that there is something going wrong. What they do first is take a pap smear. So there is a lot of fear of both biopsy and of vaccines and all those kinds of things, but pap smear is none of that. Pap smear is just a small cotton swab that gently takes some cells out. It's like taking an earbud and swiping your inner cheek with that. It's as simple as that. It's not generally painful, and it's not generally it doesn't generally cause any severe problems. We can find some cells. So one good thing about cervical cancer is the cells are very loose. So if you just swab that area, those cells will come in that cotton. And we can check them and we can see that in a microscope. So that makes it very easy to catch this cancer.
What next? Now, the steps that you've laid down, radiation, chemo, and newer super treatments like immunotherapy or targeted drugs. Do you want to talk about these as well?
So first, let's assess the tumor. So generally, we do two types of testing. What is the disease and where is the disease? So what is the disease is the diagnosis. Where is the disease is what we call the staging. So everything else is downstream from there, and everything else follows from that. The disease diagnosis can be done by pap smear. It can be confirmed by a small biopsy, and then we have to do some sort of scans. So I always say that this is like catching a gang of thieves. So what will a police detective do? First they will catch a few thieves, talk to them, figure out कि वो लोग क्या चाहते हैं और क्या कर रहे हैं, that is biopsy, and then you use your CCTV cameras and all the cameras in the city to assess where has the gang spread, and that is imaging. So CT scans, PET scans, MRIs, ultrasounds, all these things, various combination of these things is used, and that is how we figure out how much the disease has spread. In early stages, in very early disease, we can just do a small surgery, not even remove the entire uterus and get rid of the disease. So that's another good thing about cervical cancer is there is something called a stage 0, which is the cancer cells have formed, they can be seen with the eye, but they have not started spreading inside the body. So you just remove those cells and you're cured of cancer. That is the very, very important thing that everyone needs to understand, that this is a cancer that can be caught at stage 0 and eliminated with a very small surgery. If it grows a little beyond that, in stage 1, generally the treatment is just doing a surgery. Stage 2, 3, then we do surgery with radiation or only radiation or something like that. Radiation has a very good effect on cervical cancer. I'm a surgeon, and it's something. It's a kind of surgery that I love to do, but we refer most of the patients away to radiation team because they can do a much better job of treating this cancer. It just, what we say is, it just melts away the disease from outside. So radiation in conjunction with chemotherapy works really well for cervical cancer.
Right. You have been emphasizing on screening. It's like a secret weapon.
Yeah.
Now, for the benefit of our viewers, can you break down what a pap smear, you've explained that, difference between HPV DNA test, and how often should women get it done?
As you said in the introduction itself, HPV is the biggest villain in this cancer.
Yeah.
No other cancer is so dependent on something outside as this cancer is on HPV. Almost 100% of all cervical cancers are caused because of human papilloma virus infection. It spreads because of unsafe sexual contact and because of some unhygienic practices, and that is where just prevention of that infection also plays a part, but detection whether the person is exposed also plays a part. So pap smear needs to be done for all women after the age of 30, generally once in 3 years. Generally the frequency keeps going down, and as the age advances and previous smears are all normal, generally we don't do it for a very long time. HPV needs to be done if the pap smear is suspicious, or in general we do a DNA testing for HPV once in 5 years, just to make sure that there is no HPV infection lurking, and in which case we need to be even more vigilant about the screening. So HPV optional but can be done once in 5 years, pap smear every 3 years. The frequency may go up or down depending on how your gynecologist or your oncologist feels your risk is.
Right. A very important question, which a lot of people want to know about. Is cervical cancer a death sentence?
Not at all. Cervical cancers respond very well to treatment. Some of the largest survivals that I have seen after cancer treatment are from cervical cancer. In early stages, in stage 0, the treatment success is almost 100%. In stage 1 and stage 2, it is 80 to 90% success. Even in stage 3, 50% patients recover completely and are cancer free for the rest of their lives. So cervical cancer is one of the furthest things from death sentence that we can have, provided we get treatment at the right time. So बीमारी से डरना है, इलाज से नहीं डरना है. That is the most important thing.
इलाज से नहीं डरना है, लेकिन हैव यू सीन इन योर एक्सपीरियंस दैट देयर इज अ बिट ऑफ रिलक्टेंस बिकॉज women, enough women are not getting their screening done?
Hardly any women are getting a screening done.
Yeah.
And I keep taking lectures for doctors, and I ask them. I will talk about all the good things and how to prevent and what is the. When I'm talking to doctors, we're talking about the recent advances, and at the end of the lecture, I generally ask, how many women have got their mammogram done after 40 and how many have got their pap smear done after 30? Hardly any. And these are doctors who are interested in these things. So
Yeah.
we can understand what the rest of the public is. But
Yes.
I always say that we are waiting for that Russian cancer vaccine, like Rakhi was waiting for Karan Arjun aayenge. But this vaccine, which is already there, we are hardly anyone is taking it. Less than 1% of India has taken it. We are very, very reluctant about getting ourselves diagnosed. So we need to change that.
राइट, बट बिफोर वी चेंज दैट, मुझे कुछ नहीं होगा, इसका क्या करें? व्हाट डू वी डू अबाउट मुझे कुछ नहीं होगा सिंड्रोम?
तो ऐसा है कि 1 in 10 people who are alive today will get cancer in their lifetime. So if you have a family, you have an extended family, you just count the number of people which are there and you figure out how many of them are going to get cancer.
Another question. Let's talk about the HPV vaccine, which has been hailed as a game changer, right? And there are some rumors, also some myths around it also. How does it work and who should get it? Is it only for girls or boys too?
Actually, it is a vaccine which reduces the amount of HPV exposure for that individual. And when it is given in a wide society at a very high level, it reduces the prevalence of that virus in the environment itself. One, the person who's taking that vaccine is protecting themselves. Secondly, if enough number of people take it, then the virus doesn't have enough people to jump from one person to the other, and the virus slowly dies out. This is something which is both capitalistic and socialistic. You are doing it for yourself as well as for others. And we have to give it to all girls and all boys. It starts at the age of 9. Best period to give this vaccine is before sexual activity begins, so 9 to 14 or 15. And after that, we need to give one extra dose. If you're taking after 15 to 25, you need to take one extra dose. After 25, 30, generally that vaccine is not that important because it's not a treatment. It is only for prevention of exposure to the virus. So if you've already been exposed to the virus, it doesn't help a lot. Up to the age of 45 it can be taken, but as age goes on and as people are married and they have children and all that, generally its utility becomes very negligible.
Right. Very important point that you spoke about boys and men also. So it's a fact that it's not just a girl's problem?
Not at all. So boys have to take it both, again, both for themselves and to reduce the amount of virus in the society. Where do girls get the virus from? From boys itself, right? So if all the boys are also vaccinated, then all the girls are also protected. That is number one. Number two, penile cancers also are caused by this. Rectal cancers are also caused by this. Increasingly, oral and throat cancers are being caused by HPV viruses. In Western countries, around 15 to 20% of their oral and throat cancers are being caused by HPV. And in India, that number is slowly increasing. Now we are doing the testing for HPV in our oral cancer patients, and more we are finding that a lot of them are positive for HPV. So it's not just for other people, it's for our own sake that we need to get vaccinated.
Right. Doctor, you spoke about your lectures where you found out that your colleagues were also reluctant and they did not get screenings done. Now, my concern is also about rural areas. We are talking about privileged women who are your colleagues who are not doing it. What about women in rural areas? How bad or how severe is the problem there?
It's a nightmarish situation. These are generally postmenopausal women. In any case, they are neglected. In any case, their health problems take the least amount of priority that is possible in a family. After that, their problems are something that they are not very comfortable discussing, whether it's a foul smelling discharge, whether it's a bleeding, whom do they discuss it with? They are very uncomfortable discussing them, and taking them for general screening is to just out of
Yeah.
the bounds of possibility for most people.
Yeah.
So we need to reach out to them. Uh, we have to accept that their family may or may not reach out to them, and they will definitely not reach out to doctors on their own at an early stage. So that is the point of us doing camps. We go out and we do camps. That is also a very half-hearted solution, because they have to then at least come to the camp. Even that is a barrier for them. But that is where we start. We send our medical social workers, like there are ASHA workers, and in Chhattisgarh there is something called Mitanen, which means friend, which means Saheli basically. So Mitanens who go from house to house and they help other women adjust to this. But this is a long drawn struggle. I always say that if HPV caused as many penile cancers as it causes cervical cancers, it would have been finished by now.
Yes. Yes, fair point. Okay, total 3 bakwas you need to stop believing, right? And I'm going to need your help on that. Number 1, only women who have multiple sexual partners get cervical cancer.
Not at all true. It is a virus which is very prevalent in the society. So sooner or later, every man and every woman is going to be exposed to it, whether you are in a monogamous relationship or you are in a multi-partner relationship.
Biopsy spreads cancer.
That is the biggest bakwas that is spread by most of the people who either want the cancer to spread and then people to have bad results, or they have never read science. See, biopsy is just like taking a few cells out of the body and asking them. A very minuscule percentage of biopsies, deep-seated biopsies with a needle, have a 1% rate of spreading cancer. And unfortunately, scientists are honest people. They will tell that there is this 1%, and that is exaggerated out of all proportions, and now people are scared of getting all kinds of biopsies.
The third one ही तो मुझे खुद ही लग रहा है, but I'll still ask you because you are the qualified person here. Using tampons or contraception causes cervical cancer.
Oh no, contraception reduces cervical cancer. We have learned that this is a sexually transmitted disease. If you have to have multiple partners, at least use condoms. And using tampons is safe. It has to be used safely. It is used worldwide. It is not at all an issue.
Okay, now this is something that might be personal to you, and if you would like to share something with us from your experience, is there any story that you want to discuss with us where somebody beat cervical cancer, or a story that changed your life as far as your experience with this disease is concerned?
So this is actually not exactly cervical cancer, but this is a true story of my cousin. I was doing my MS in surgery. I was at Sion Hospital in Mumbai at that time. And my cousin from a small tier 2 town, tier 3 town in Madhya Pradesh, she came here with very advanced ovarian disease, which was missed earlier in that town. And she had to undergo a very huge surgery. Okay. It was an ovarian cancer which had spread almost to the level of the lungs. So you can imagine the entire abdomen was involved, and it was a 7-8 hour surgery. She lost around 7-8 hours. She lost around 7-8 liters of blood during that surgery. A human body only has 5.5 liters, na? So all of that blood was replaced at that time. And she kept losing a little bit more blood like next few days, and then she had to undergo several more surgeries after that. Then she had to undergo chemotherapy and even more surgeries. And I was doing my post-graduation, and I was like, why are we doing this to her? We should have just let her go. And this was around the year of 2000. Today she is building smart cities in MP. She is a chartered accountant and building smart cities in MP. Wow. So she was the reason I got into oncology in the first place. She was the inspiration who brought me into this field, and she's keeping me active. So, Bena?
Yes, thank you so much. And thank you for doing what you're doing. And thank you for giving us such an inspiring story. And this is a message to your sister. I want to ask you because you shared a lot of important things with me, including a very personal story. If there's one message, heart to heart, whether it's to a parent, whether it's to men or women, what is the action that everyone needs to take now who's watching you?
So one thing that we need to understand, there is a very peculiar 80-20 rule in oncology. 80% of tumors in stage 1 and 2 are cured, only 20% in stage 3 and 4. And the tragedy there is approximately 80% Indians turn up for surgery when they're, or any treatment when they're a stage 3 and 4. That perpetuates a cycle. कि I turn up late, there is an 80% chance that I won't have a good outcome. And then someone in my family will see, अरे वो चाचा भी तो लेट गए, वो चाचा ने कैंसर का इलाज कराया था, उनको कोई फ़ायदा नहीं हुआ, तो कैंसर का इलाज करा के किसी को फ़ायदा नहीं होता है. Then he will also go late. Then his bhatija will also suffer. And that is the self-perpetuating cycle that is building up in India. And a lot of unscrupulous people who are taking advantage of this are selling a lot of fake treatments and doing a lot of harm to India. Because every day in our OPD we see around 30% patients who knew they had cancer, but they were swindled by someone, given some sort of an alternative treatment, and their stage 1, stage 2 tumor became stage 3, stage 4 tumor.
So, if you're watching this conversation or listening to this conversation, it's very important to go to credible sources and science.
So it's very simple.
Yeah.
Whenever you are going to treatment from someone, ask them not for their own personal record, आपकी ब्रांच का कैंसर में सक्सेस का परसेंटेज क्या है और वो कहाँ पे पब्लिश हुआ है. Alternative medicine is a $25 billion per annum industry in India. So it's not as if they can't spend 10,000 rupees and call up all their patients of last 5 years and ask them कि आप ठीक हो कि नहीं हो. It just takes one phone call. But if they're not doing it, that means either they are not interested or they have done it and they are ashamed to tell us the results.
Absolutely.
Just ask this success percent.
Okay. Doctor, अब एक rapid fire round. And I think a lot of questions will be answered through this, and we'll do this very quickly. And this is our myth busting exercise because there are a lot of rumors and myths and apprehensions, of course. And in order to fight that, I'm going to need your help again. And we will be very quick, super quick with this rapid fire round around cervical cancer. Question number 1: only women with multiple sexual partners get cervical cancer.
No.
If I feel perfectly fine, I don't need a screening or a test.
That is exactly when you need to get screened.
Having HPV means I will definitely get cancer.
No. Less than 1% of those with HPV get cancers.
Pap smears are painful and can harm you.
Pap smears are just a cotton ball. They don't harm you at all.
Doing a biopsy or surgery can spread cervical cancer.
Not at all.
HPV vaccines are unsafe and can cause infertility.
Not at all.
Men don't need to worry about HPV.
Of course they do.
If you are vaccinated, you don't need to get screened.
No. After vaccination also, everyone needs to get screened because vaccination is for a limited number of strains of the viruses, and we need to ensure that the other strains don't cause us trouble.
Cervical cancer runs in families, so if my relative never had it, I'm safe.
Not at all. If your relative had it, you may have it, you may be safe from it, and if your relative never had it, you may still get it.
Last one. Cervical cancer means you can't have children.
Not at all. Cervical cancer in very early stage, we can cure it by just removing the part affected, and then you may have children.
All right, so this was the end of our rapid fire round. Thank you so much, Dr. Sharma, for being so patient and answering all our questions in a language that I understand, your mother understands, my mother understands, and I'm sure all our viewers understand, because it is very important to fight the myths. And thank you so much for being so cool around this sensitive topic. I would like to give you a high five for this.